Assalamu alaikum wa rahmatullahi wa barakatuh. To continue the series, we've talked about puberty, we talked about erections, something that came up which was kind of a request, which I hadn't thought about previously, but I think is a really good idea, and that's to talk about testicular cancer, which is a little bit funny because I realized that based on the research I've been doing, checking for cancer in any form on your body, we're taught, at least here in the West, I don't know about other cultures, but we're taught that we're supposed to be understanding our body and noticing when things are different. For example, I had skin cancer. I was diagnosed with skin cancer last year, I think, and then I had it treated. Alhamdulillah, everything's good. But knowing enough about my body that when I noticed something that was different, something that didn't look normal, something that I hadn't seen before, then there was a bit of a concern. So that's kind of what I want to talk about here, is that because unfortunately we always focus on the sexual aspect of the private parts, the genitals, but we don't focus on just general health care in terms of the genitals, right? It's always about the pleasure aspects of it. Yeah, we know why. For those of us who are mature and have learned, but the reality is that we have to learn our bodies, and I've been kind of emphasizing this in previous videos, that we really have to learn our bodies and to understand them. So one of the things I kind of want to get out of the way, and I'm going to start doing this more often, people may not like it, but it's something that I really have to start doing. But patreon.com/Canadian Muslims TV, you can sign up as a patron. It's crowdfunding to help us continue making the videos, help us, meaning me, inshallah, even with the funding, help me to develop more, better quality and so on. So if you can go to patreon.com/Canadian Muslims TV. See, I'm just so caught up in myself that I can't see the difference. I keep putting my name in there. Anyway, we got to have fun with these things, right? So anyway, something I learned, it's interesting because a lot of these things I didn't know myself, but I mean, just going through preparing for these videos, I learned a lot of little facts and little tidbits about stuff. For one, from what I understand, the word avocado is the root of the word is an old Aztec word, which means literally testicles, right? And it's interesting because the avocado, from what I've seen, I don't know if it's true or not, I'm throwing this out there, but from what I've seen, avocados grow in pairs, right? So you have they grow side by side on a tree, so which is interesting. And now, so through just the way human behavior is, we notice something, so we start to share the same word from there. Oh, hey, look, they start to adopt. So just a little tidbit out there. Maybe if anybody knows more about it, please feel free to share. But one of the things that you'll notice for many, and some people may not notice this, many, it's just little weird things about the human body that people just don't pay attention to. But the penis will lean to one side or the other, either to the left or the right. And the reason this is because the testicles don't sit 100% side by side. One is a little bit higher than the other. And what happens is this causes the penis to actually sit against the higher testicle, and it'll either point to the left or the right. And this is normal, right? If anybody notices this and they see, well, hey, things are looking a little weird down there, that's why, right? But it's a totally natural thing. So another little kind of side little tidbit. Now, if you're kind of, it's just the nature of the way two balls sitting together with a stick on top, subhanallah. You know what I'm saying? So, but yeah, so these things are important, as I mentioned before, because you have to understand these things so that for, the youth, if, get to know your body to a certain degree. And as I said, try not to make it all about the pleasure. Just think of it from a health standpoint. You need to know your body, because if something happens, you get infections, you get rashes, many, many things can happen. And knowing these little details might help you to understand, and to help you prevent some serious illnesses. Now, in terms of the testicles, the exams that they do are actually quite simple. One of the things that you have to be very careful. They are very sensitive. So, but basically, the best way to describe it is kind of like a little bit of an egg. It kind of looks actually similar to an avocado itself in terms of the shape, I guess, to a certain degree. But it's inside the scrotum or the sac of skin, and it is a little ball, and it's sensitive, right? Now, what happens is the semen, the sperm, I shouldn't say the semen, the sperm is produced in here, and it comes out, the sperm comes out through tubes at the back of the testicles. So if you, I'm a little short on the video here, but if you basically, the exam that they would do if you went to a doctor, for example, got this, but you should learn to do it yourself. And I'll mention that in a little bit. But basically, the simple exam is what they do is they take it in your hand, and they just use their thumb to kind of go around, and they check underneath with the fingers to see if there's any hard spots, any lumps, anything kind of like this. But you got to be careful. The reason I'm saying that there's tubes at the back, because those feel like a little bit of lumps. But if you actually feel the lump and you kind of go up the lump, you can feel two tubes. Feels like, you know, right, two soft, like thick strings maybe. Right? It's all sensitive. It's all through sense of, right, of touch, because you can't see it. But yeah, they suggest, from what, at least here in the West, I mean, I shouldn't say the West, but in Canada and the United States, they suggest that young men start doing this shortly after they start going through puberty. I mean, the average age now, they suggest, is, 14, 15 years old. So yeah, because if you find any kind of lump or anything like that, you get an examination. But as I said, you got to be very careful, and just like, if you check it out at the back, there is a little bit of a lump, but that's where there's tubes. Basically, it's kind of like two tubes with a little ball hanging at the bottom, right? Like just like an avocado if you look at the pictures of a tree. But so it's a very simple, straightforward thing. Takes about 10 seconds. The suggestion too is to do it in a warm environment, such as in the tub or in the bath, in the shower, because I think I mentioned it before, but the scrotum is sensitive to temperature changes, and when it's cold, it kind of sucks up into the body, and when it's warm, it kind of relaxes. So you can actually test and check it out, right? And as I said, it only takes a couple of seconds, and you get to know your body. And the interesting thing is, if you do this, I should actually check on this, because I didn't check the frequency, what the suggestion is, because it's always kind of changing. But I don't know, maybe once a month right now. I'm just throwing it out there. But again, somebody help me out here, add this information. But it's something that you should learn to do and check it out. The reason it is important is because we hear the word cancer, right? Now, again, some of the research I've done with testicular cancer, which is a little bit odd, is that people one of the symptoms of testicular cancer can be sensitive breasts for men, which is a bit interesting, because you don't make the connection, right? We think about, how do you say, breast cancer, right? We don't think of breast cancer in terms of men, because it's not as common, right? It's far more common in women. Men do get breast cancer, but it's not as common. So testicular cancer, one of the side effects is that sensitivity. But I have no idea what that feels like, what that means, but there'll be probably something like this is something, just an interesting side effect, because it's I think they said it was the endocrine system. So it's all kind of connected, right? And so this is a side effect of testicular cancer. Now, what I've read in terms of statistics, obviously any form of cancer being caught early greatly increases your chance of survival. I had a friend who passed away, Brother Yaqub, Tom, who had converted to Islam a few years after I did. We went for Hajj together, and he got sick at Hajj, and he'd come back. And I guess he'd been having some issues for quite a time, but he just didn't really make the connection. And he went to the doctor thinking it was one thing from maybe getting sick at Hajj. And it turns out that he had lung cancer. And then they did surgery shortly after, like very quickly afterwards. And they found out that he was already like stage 3, stage 4, like he was already in that, there was really not much they could do in terms of, the treatment. Like his survival rate was quite low at that point. Basic is where by the time he caught it, because maybe, I don't know, Allah knows, but maybe there was a lot of symptoms that he just didn't connect the dot. Because a lot of times too, we get side effects somewhere. So that breast, the sensitivity and the pain in the breasts. We should look into this a little bit more, but it's kind of interesting. But you may not make the connection that there's something going on further down in the body, right? So again, just the general principle of what we're getting here is that learn your body, right? As I said, I had skin cancer, just a spot on my back that I touched something and it just felt weird. I got my wife and my mother to look at it and they said, that doesn't look right, that kind of thing, because it was in a position I can't see it on my back. But you know what I mean? So, but I recognized that there was something there that wasn't there before, and it didn't feel like a mole, and it didn't feel like a bug bite or anything like this. So, basically, this is what we're getting at in this video, right? So young brothers, it may seem weird and uncomfortable at the beginning because it's not something you're used to doing, but just it's, how do we say? Because people will frown upon this stuff because they're worried about what could happen, but at the same time, we're neglecting other things that could happen. So, my advice is to young brothers and your young sisters, take the time to look at your private parts. I'm not sitting here indulging and fantasizing, getting into all this weird stuff. I'm talking about just take a minute, once in a while, just, when you go into the bathroom, when you're in the shower, just take a look, maybe once a month, just check to see, because anything can happen to anyone at any time. And if you notice something, you check, you do your test, and after 3 or 4 months, all of a sudden you notice a difference and you notice a little lump, you say, look, I've been doing these exams for the last 6 months or 6 years, and this has never been there before, and I noticed something. Right? It could be the dramatic difference in terms of your treatment. Sometimes it could be just nothing, right? Things happen. So anyway, I thought that was a little interesting one. Inshallah, I have another topic for next week, which will be sexual innuendos. So we'll see. A sister had requested this, and this one's going to be a tough one. I'll have to think about this one, but inshallah, this was beneficial. And thank you to the sister who... well, she's not a sister in Islam, but I pray she accepts Islam. I met her and her husband. She suggested this, the woman had suggested this because she's currently going through cancer treatment for breast cancer. And she had made the suggestion that women are constantly told to do breast exams, but you don't really hear the same thing being told about men. For example, I come from a family that breast cancer is so high in the women in my family that I am highly encouraged to do breast exams, because my chances as a male could be potentially dramatically higher because of the number of cases in my family. So it's family history. All of these things are just preventative. A couple of seconds may make a big difference. So may Allah keep you safe. May Allah keep you happy, beneficial. May Allah guide people through this information. I hope it's beneficial, and anything that is false and incorrect is just my mistakes, maybe not being prepared enough, but anything good that comes from this is from Allah subhanahu wa ta'ala. Assalamu alaikum wa rahmatullahi wa barakatuh.